Rabies is a preventable viral disease transmitted through blood or saliva. In West Virginia, raccoons are responsible for about 90% of rabies cases. Other animals that might carry rabies include bats, foxes, and skunks. The best way to reduce your risk of exposure is first and foremost vaccinate your pets. Not only is it the law, but it's the most common reason that people are exposed to rabies. Make sure food sources such as dog food or trash are inaccessible to raccoons and other wildlife to further reduce your risk. Also, make sure your yard and home aren't inviting areas to live. For example, fix any holes that might allow animals access under your porches or decks and clean up clutter around your yard. Finally, if you need to dispose of a dead animal, make sure you wear gloves to avoid possible exposure or put some type of barrier such as a bag or a couple of bags in between you and that animal. Sometimes people will see a nocturnal animal such as a raccoon out during the day and assume that that animal is infected with the rabies. That's not always the case. They can be sick. However, sometimes they just need extra food or have to be active during the day to meet their energy demands. Some signs that an animal is rabid are aggression, lack of fear of humans, and wandering without purpose or wandering looking dazed and confused. If you suspect an animal may be infected, contact your local animal control office, also West Virginia Division of Natural Resources or USDA Wildlife Services. If you believe your pet has been exposed, contact your local veterinarian. Finally, if you suspect that you have been exposed to rabies, seek immediate medical attention. Contact your doctor. Vaccination after exposure is highly successful in preventing the disease if administered properly.